Congratulations to the Geisinger Lewistown Hospital School of Nursing Class of 2020. You are now well prepared for your launch into an exciting career in one of the most satisfying professions on the planet. And you're being graduated from a school that is a Geisinger gem, consistently rated among the top nursing schools in the state. Graduates of this School of Nursing have the highest board pass rate in the state, so I'm confident you'll ace them. I've always had enormous respect for nurses. In fact, I credit my success as a doctor to my respect for nurses. I remember clearly the morning of my first day as a medical intern, right after my graduation from medical school. I had started before dawn, seen all my assigned patients, reviewed all their charts, and thought I was ready for rounds. After our team rounded on my first patient, I felt proud in reporting my assessment and listing my plans for him that day. The head nurse paused, cleared her throat, and respectfully suggested, "Yes, doctor, but might you consider doing X, Y, and Z instead?" I thought for a nanosecond. After all, I had just graduated from medical school. I was proud of my medical knowledge and thought I knew a lot. But this woman clearly had experience, compassion, and wisdom. I clearly had a lot still to learn, and she had a lot to teach. So I responded, "Yes, thank you," and revised my plan. I view that as a formative moment in my career. We are all members of a team, and our patients' interests are best served when we function as a collaborative team with mutual respect. When you signed on for training as a nurse, I'm sure you expected it to be hard and enormously gratifying. But I'll bet you never expected the challenges we've all faced in these past few months. The COVID-19 pandemic has disrupted your final months of nursing school as it has for students across the country. You were pulled abruptly from classes and the clinical environment and had to adapt to virtual reality for the last 5 months of your program. I'm told that you have accepted this with resilience, grace, and creativity. Your medical knowledge gives you an appreciation that in the absence yet of demonstrated effective therapies or any vaccine, social distancing and masking is our only tool to contain spread of the virus. This very ceremony represents a creative way to allow you to celebrate together with at least some of your classmates while observing the restrictions that keep us and our community safe. Your acceptance of this and your leadership in helping others understand the need to observe these restrictions gives your faculty and your school yet another reason to be proud of you. In just a few months, this pandemic has claimed nearly 3 times more American lives than the 19 years of the Vietnam War. To find a precedent short of war that has had such a broad effect on society, we need to reach back over a century to the influenza epidemic of 1918-19. Generations of students have had to confront epidemics, but even HIV/AIDS, which doctors, nurses, and students in the 1980s first knew as a frightening syndrome that was killing young people that had no name and no known cause, even HIV/AIDS did not disrupt the lives of every single American as COVID has. And despite what we have learned about how to reduce the spread of this virus, we are seeing it ravage broad areas of this country where unfortunate reluctance to masking and distancing has given it the opportunity. People are predicting optimistically that we may have a vaccine in the next 6 months. Producing a vaccine for a previously unknown disease this quickly would be unprecedented, and nobody can be certain when we will have one. One thing we do know is that your careers in nursing, starting now, will be different from what we would have envisioned just a few months ago. You are graduating into the profession at a time when trust in our institutions is being seriously challenged. At a time when we need science more than ever, large segments of the population question the fundamental tenets of science. Trust in the independent press, academic expertise, and our governmental leaders is eroding. But nurses have always enjoyed a high level of respect, consistently higher than any other profession in national and international polls. And this pandemic has highlighted the heroism and self-sacrifice of nurses and other health caregivers in the front lines. At a time when trust in other institutions is being undermined, trust in nurses is now even higher than ever. There are good reasons for this. Nurses are seen as holding the welfare of their patients ahead of their own well-being, as you have now sworn to in your oath. Unlike those who may ignore or bend facts or science to fit other agendas, nurses are seen to have only one agenda, the welfare of their patients. Nurses are seen to take personal risks in service to their patients. Nurses are seen to care. Nurses are invited into the lives of their patients in very special ways. Patients trust nurses with their bodies and their secrets. This is a great privilege that needs to be earned and for which you should be grateful. You have earned the diploma that you're receiving at this ceremony, but the privilege of your patients' trust is something that you have to earn anew every day. You will earn this trust by caring about them and caring for them as if they were your family. It is caring that guides nurses in making the best decisions, in giving the best care, in putting themselves in harm's way during an epidemic to take care of their patients. It is because nurses care that they are trusted. And if you really care about your patients, you will discover how much they have to teach you. They will teach you about life and illness and suffering and death and hope. So be worthy of this trust by caring. Let this be your North Star as you embark upon this noble career. If you do, then you will be able to face all the challenges ahead of you, whether it be a global pandemic, a war, the grief of a family member, or the suffering of a single patient. I know that the proud faculty of your nursing school are confident that they have prepared you well. Now it's up to you. Congratulations.